work in these regions that the ministry, have or has posted them to?
Good evening, Mr. Afi, and good evening to your listeners as well, and those of our viewers on the other side. No. If you put it that way, I'm not sure that's the case. So the doctors are willing to accept posting. Indeed, many doctors have accepted postings when the opportunity came for them to choose their places. However, all of us are concerned about the response rate. Okay, and if you look at the numbers that eventually decided to pick up the postings, you'd notice that Greater Accra was the highest, and then the two adjoining regions, Central and Eastern, had about 50% above response rate, and the same with Ashanti region, which is a magnet on its own. All over the country, none of the regions were reported above 50%. So it tells you a story, okay? And let's not pretend that we don't know why. Why is it that Greater Accra, adjoining regions, Ashanti are attracting the largest numbers? And it's about opportunities, and that are available, and leveraging on what these areas bring. So as an association, and a responsible one at that, internally we have been, pushing for the clearance that was issued. Secondly, we've also been urging our junior colleagues to accept postings to these areas. But unfortunately, you can't propose, but the end person, decides exactly or what they want. And unfortunately, what we all wanted didn't happen. And the reason are not far-fetched. One is because of the opportunities there. One, you would have better amenities in the rural, in the urban areas compared to the rural areas. And I know doctors who maintain two families. One where they work and then one in the city, so then their children or family can attend good schools. And so they have to traverse between these two places on a regular basis at risk and at their own cost. Opportunities for postgraduate training, which is limited once you are in the deprived area. And I'm sure we'll talk about solutions later. But the incentive to work there is limited in terms of housing, for instance. Some accept posting, but they go and they don't know where to live. They have been probably lived in other areas apart from where they are being posted. They accept and they go and there's nowhere to live. And that also delays in starting work. I work in Accra, for instance. And as a senior person, later when I'm done with my official duties in Kolebu and also with the medical school, I have the opportunity to work elsewhere for extra income over the weekends and all, which may not be available similarly to those who take up posts in the rural areas or the deprived or less endowed areas. How then do we bridge this dichotomy? Because they may even be working in terms of hours, longer hours. So these are some of the reasons why, it is not, the outcome is not what we wanted it to be. And all of us as a nation, our stakeholders will have to put our heads together and see what we can do. But I tell you, the answers are not far-fetched.
You talk about solutions, which will be the next conversation. But then let's still stay with, the issues you raise. Does it mean that these doctors are posted to these regions that you mentioned without accommodation? And so what? They say go to, let's say, Upper West region, because from the statistics given by the health minister, in a region like Upper East and Upper West, in Upper East, 35 doctors were posted, 0 reported. Upper West, 32, 0. Does it mean these doctors are just asked to, we are transferring you to Upper West, just go there? You are not told about accommodation. You are not told about incentives, nothing. You are just posted to these areas?
Well, I think you are not far from the truth. So whatever I'll get in Accra is the same as what they get. If they get accommodation in Upper West or Upper East, is a bonus. And I won't be, I will have to be honest. Some places have accommodation for doctors and other health professionals, and they will take advantage of it. But in many places, that does not exist. And you have to go and make inquiries and then make arrangement for yourself. So that then adds to the delay in accepting, and even the accept, assuming any duties in this area.
Prof, I want to get some understanding. So they go to these areas, no provision for them. So the doctor has to go in search of accommodation.
Yes, in certain instances, I tell you that the plain truth. In some instances, they'll be lucky to have accommodation provided already. Somebody was in and left, so you can go back. And sometimes they have accommodation, maybe 3-4 rooms or places, but the doctors are more than what they have. You have to go and look for it. They may help you, but then until they secure a good accommodation for you, you have to, join the search party, and sometimes it may take you time to even fix these accommodations for make it habitable for you to move in. So it is not as simple as painted.
Sorry to cut in. And when you find, the accommodation, you must pay from your own salary, or there's an incentive, or there's some allowance that will be given for you to pay for the rent of this accommodation you talk about?
No, so certain district assemblies would support. In fact, they may have certain buildings or bungalows of facility earmarked for such public officials to live and work in. So if they are in good functioning condition, you can have it. If they are not, they may fix it for you. That may also add to the delay. But in many instances, this does not exist, and you have to go and fish for it. And I am happy. I mean, I'm not sure we already talked about solutions, but let me quickly add that last week, for instance, there was a meeting in Damango where the minister attended, and the GMA was invited, and the discussion had started even then, and the call on district assemblies to also step in became quite evident, and we support that, and it's one of the solutions that we've been proffering, to partly solve the situation that district assemblies must be bold and put their monies where their mouth is, and say that it's not just doctors. Let's not make the conversation just about doctors, nurses, and other health professionals. Indeed, any other public servant that you think your district needs, make the provision, in your annual budget, and say that we want to help attract and retain these people to help take care of our people in these underserved areas.
The accommodation issue, I've just received a text message from someone in the upper, East region. And the person says that a building was constructed for the doctors as part of the renovation project for the regional hospital. And this was commissioned by President Akufo-Addo in his last days in office. It's just that the doctors have refused posting to these areas, even though there's accommodation for doctors in that region.
Okay, so, right. And I don't think we've all said anyway, and even in this conversation, that the only issue is accommodation. And I haven't said that. We are talking about generality of opportunities and incentives in these areas, including accommodation. Okay, now let's take Upper East, for instance. You know what is going on, the conflict, the attacks on individuals, and I know of staff from the Ghana Health Service and Ministry that have been attacked, even Kofodia recently and all that. So when you have a preponderance of such negativity in a particular area in this country, then that, puts people on the edge in accepting positions to this area. And now specifically I mentioned Upper East. Okay, so if you see Upper East to be zero, the other reasons why people, doctors are not accepting postings to that region would suffice in terms of opportunities to work, facilities for postgraduate training. But the added reason why people may not accept is because of security risks and life and threat to life. Okay, so the reasons vary and according to where you find yourself. But we are saying that we know the reasons, core and core. Okay, and let's not pretend. Look, I have been at the highest level in these discussions within and outside this country. I've been to the UN. I've sat in the American Medical Association meeting, Ghana Physicians of, and it is there. Look, doctors and health professionals that work in deprived areas, even in the US, are incentivized to work in those areas. You cannot tell me that if I work in the cold of Alaska, with all the difficulties that exist, I should be paid the same as somebody who is swimming in the beaches in Florida and Miami. No way. If you go to the Siberian in Russia, for instance, there's differential incentivizing. Many places. So we agree that doctors should be altruistic and be patriotic and accept postings. But the same conversation has not achieved the desired result. 15 years ago, we had an annual general meeting in Tamale where the Minister of Health was for Northern Extraction, the Chief Director was of Northern Extraction, many other high-ranking officials in the ministry. The same conversation is nothing. 3 years ago in Bolga, it didn't happen. So why are we here again and talking about the same thing? And I can tell you, there's a document lying at the ministry called the Deprived Area Incentive document, where the ministry and its stakeholders put together recognizing the difficulties in achieving equitable distribution across the country. That somebody who works in a very deprived area must be incentivized. Okay. And is gathering that.
Okay. Doc, I'm racing against time. So let's talk about solutions. No problem. Let's talk about solutions now. How do we address this challenge? Are we waiting for all these areas to have the best of equipment, the best of accommodation before your members will move in there?
No, we are not. No. And I told you that we are already doing our in-house work, scolding people who didn't accept, trying to find out reasons why. And they have their concerns. So whilst we are doing our internal, work, their concerns are what I'm relaying, that some of these things ought to be fixed in a holistic manner to ensure that the good people of this country benefit from the investment that we have made in these health professionals, not just doctors, but nurses and others, to ensure that if you find yourself in a deprived or underserved area, you will still get the best of care, even when you need it in your times of need.
The health minister says, your colleagues should report within a week. After a week, there will be validation. How do you react to this?
Well, I listened to a script or excerpt of his publication, and I'm not sure he entirely said it was an ultimatum. He said that they were working to, resolve the matter within a week, and then they will take certain decisions. I think as a manager, you need to have that and say that I need to move on and decide what the next steps are. So I will grant him that because he's a leader. He must say that and prepare. But beyond those assertions as he makes, we as medical association stands ready to engage the ministry and other stakeholders and engage, so that boldly together, let's have an honest conversation and see how we can collectively solve this problem. The ad hoc decisions will not help anybody.
How long will it take for your members to go to these areas that they've been posted to?
Well, if you ask me, this is a serious platform. I'm not sure I want to commit to anybody. But we are saying that we want to raise the percentage from what it currently is to a higher level. But having said that, we cannot run away from the bare facts. And the truth is that let's be pragmatic and put where money where mouth is. And let's say that let's incentivize these young doctors and make provision for their upkeep. And also improve on their future prospects in terms of postgraduate training. And let's also decentralize postings. If you do it at the ministry level, you block the chances of people who may have chosen places that others may wish to go. So let's send the opportunities for attracting people to the regions. Then they will advertise, and the people will then walk and apply. In that way, people who are genuinely interested in serving in these areas will go and get the application rather than doing that at the national level.
Prof, thank you very much. But the people of Upper East and Upper West are begging you to send your people there.
Oh, yeah,
receive a number of WhatsApp messages
to them,
begging your people to come.
Yes, we are responding and doing the right things. But what we ask that, once we do that, we should also be met with some of the concerns that our members have. Thank you.
Prof, thank you very much for your time. Professor Ernest York is the president of the Ghana Medical Association. Let's do the Public Utility Regulatory Commission now.